Thank you, Mr. President. Earlier this afternoon, we had a very strong vote here in the United States Senate to move forward on the legislation we're currently considering. It's called the Comprehensive Addiction and Recovery Act. It's legislation that is intended to make the federal government a better partner with state and local government and with our nonprofits who are in the trenches around the country and all of our states dealing with this now epidemic level of heroin addiction, prescription drug addiction, overdoses. Today, as we are here in the Senate, on average, we'll lose over 100 people a day in the United States of America to deaths from overdoses. And frankly, that's just part of the problem, as horrible as that is. So many people are being saved by this miracle drug called naloxone or Narcan. Also, others who may not be overdosing are not working. Their families are broken apart. They are committing crimes to support their addiction. So many Americans are not achieving their God-given purpose because of this addiction issue that is gripping our country. So our legislation is meant to address it in a very direct way. The debate on the floor that we've had over the past week has been very interesting to me. It's the first time in decades that this Congress has taken up this issue in this manner. We have had a very open debate on addiction policy. What does it mean? I think what you've heard members say on both sides of the aisle is that we have learned a lot about addiction over the years, and that addiction now is viewed by most as a disease, an illness. Like other illnesses, it needs treatment. And I think that's a very important change you've seen in terms of how we address this issue, and the policy before us today and on this floor that I hope we'll vote on within the next 12 hours or so represents a change in thinking about this. That indeed we want to do everything we can to prevent the addiction in the first place, to keep people out of the funnel of addiction, to have better efforts at education and prevention, and that's in this legislation. But also that once we have people who are addicted, we need to get them into treatment. And that for people who are arrested for possession, who are users of drugs, better to get them into treatment and recovery than just getting them into jail or prison, because we have found that that hasn't worked. So, yeah, the criminal justice system has a role to play here. Legalization is not a good idea. But that ought to be in part diverting people into this treatment that works better for them to be able to get at this problem. Otherwise, folks will continue to see these incredibly high levels of use, addiction, and all the negative consequences that stem from that. I want to thank my co-author of this legislation, Senator Sheldon Whitehouse. He and I have worked together over the past few years on this legislation, bringing in experts from all over the country and getting expertise from our home states. In Ohio, we've had a number of roundtable discussions that added a lot of important input to be able to come up with legislation that actually works, that's actually going to direct funding to evidence-based programs in prevention and treatment and recovery that work. We've talked a lot to our law enforcement community. That's one reason the Fraternal Order of Police supports our legislation. So do the Sheriff's Association, so do the prosecutors, so do the attorneys general, because we have actually worked with them to say, how can you be more effective in dealing with this very real problem you have in your community? And if you talk to law enforcement, you talk to firefighters, you talk to emergency medical folks, they will tell you this issue is at the top of their list. They're frustrated by it. They're looking for solutions, and this legislation helps to come up with those solutions. I also want to thank Senator Ayotte, Senator Klobuchar, and 42 bipartisan co-sponsors for their support of this legislation. It is comprehensive, it is evidence-based, and it's going to make a difference. Not only does it have a lot of support here in the United States Senate, and I hope we'll see that again in the final vote on this, but it also has support in the House of Representatives. There is a companion bill. At one time, it was identical to our legislation, also called CARA, the Comprehensive Addiction Recovery Act. Ours has changed a little bit through the process, but it's very similar to the House companion bill. Over 80 co-sponsors of that legislation, bipartisan bill on the House side as well. So this is one of these issues where if we pass it here in the Senate, we have a very good chance of passing it in the House, getting it to the President for his signature so that it can begin to make a difference in our communities. The reason we're here today talking about this again is so many people are suffering. There are 23 million Americans, it is said, 23 million Americans who are in recovery from addiction. Think about that. We're doing this for them to ensure that they can have successful recovery, to help them to ensure that they can keep their lives together and not fall back into this struggle of addiction. But with 23 million people recovering, think of the millions who are still struggling. Together, those who are recovering and those who are addicted have begun to stand up and let their voices be heard. And that's one of the differences I've seen in this debate, is that the stigma that has been associated with addiction has begun to be removed. There was a rally here on the mall, on the Capitol Mall, several months ago. It was called Unite to Face Addiction Rally. And there were people from all over the country there. Thousands of people came to Washington, D.C., thousands. And the message from them was, one, pass CARA, this legislation, and I appreciate their help. We wouldn't be here today on the floor talking about this issue if they hadn't engaged with their elected representatives in the House and the Senate, our leadership, and helped us to get this moving. But second, their message was, look, addiction is a disease. It has to be treated like other illnesses. And we have to have legislation that helps break the stigma associated with drug addiction so that we can address it, we can begin to get people out of the grip of addiction and get our communities and our families out of the grip of addiction. This is a cause, and it's one that requires, yes, law enforcement, the criminal justice system, but it also requires love and faith and communities coming together. It's one that we can only carry out together, all of us. Not as Republicans or Democrats or independents, but as Americans, as fathers and mothers, as family members and friends and coworkers who care about those who are facing this great challenge of addiction. CARA now has the support of over 130 groups around the country. These are criminal justice groups. These are people who are in the trenches every day dealing with treatment and prevention. These are folks who are in public health. These are people who are in law enforcement, understand the importance of this. They've all come together to say, let's pass this legislation so we can begin to implement this evidence-based program to respond to this epidemic. It does add prevention and education efforts. It does do a lot to get prescription drugs off the shelves, get the medication out of the hands of our youth. It does a lot to monitor drugs. It authorizes law enforcement task forces to combat heroin and methamphetamine in areas that are particularly hard hit. It expands the availability of this miracle drug we talked about earlier. It doesn't always work, but it saved a lot of lives, called naloxone or Narcan. In the criminal justice system, it does identify and treat individuals suffering from substance abuse disorders and expands diversion and education efforts to give those individuals that second chance. We give special help in this legislation to our veterans. We establish more funds for these veteran treatment courts. I've been to them in Ohio. They're incredible. I talked about a story yesterday of one of the veterans who had been in and out of the prison system. Now he's not only got his life back together, he's got his family back together. He's back in school getting a degree. He's one example of many who got off track because of PTSD, because of an addiction, self-medication to deal with his PTSD in the prison system and now back out. We're supporting that effort. We do help women who are postpartum and suffer from addiction. We do help babies who are born addicted with this incredible situation where we have now in Ohio a 750% increase in the number of babies who are born with this syndrome, with addiction. They have to be taken through withdrawal. And going to these neonatal units, as I've done with my wife, and looking at these incredibly compassionate nurses and doctors, what I hear from them is, Rob, you've got to do something. You've got to do something. This legislation takes that important step at the federal level. It supports recovery programs focused on youth, building communities of recovery. It creates a national task force on recovery to get the experts really engaged to help us improve ways to address some of the collateral consequences caused by addiction. Economists will tell you that addiction now costs this country about $700 billion every year. Think about that. That's lost productivity. That's more expensive health care. Go to the emergency room in your community and find out what's going on. You'll see a lot of people coming in because of addiction. It's because of the cost of policing, at the cost of incarceration. Law enforcement back home tells me most of the crime being committed in our communities is now being committed because of this issue. $700 billion every single year. That's a lot of money, no doubt. But addiction costs us something else, too. It costs us in dreams that are never fulfilled, in families that are torn apart, in lives that are lost. We don't just measure our success in dollars and cents. We measure it in safer neighborhoods, less crime. We measure it in empty jail cells. We measure it in the number of people who never have to struggle with drug abuse in the first place because of more effective prevention and education. We measure it in the moms and dads who beat addiction so they can come back to be with their kids and bring their families back together. We measure it in the families that are not torn apart but instead are healed. As we move forward to pass this legislation, the Comprehensive Addiction and Recovery Act, our message is a really simple one. To those who struggle with addiction, to those who think they cannot overcome, to those who believe there's no one out there who cares about them or can help them, you are not alone. We are with you. There is hope. I've seen people beat this. I've known people who beat this. You can beat this. And we can be a better partner here at the federal government to be able to help people to overcome this struggle. We need to pass this bill and get it signed into law to begin to make a real difference for the families we represent. Again, the House of Representatives has some companion legislation. The companion legislation is also called CARA. They have a big bipartisan group supporting it. I hope after we pass this legislation here, because I'm confident we will, based on the vote this afternoon, that the House will take it up. Take up CARA. Get it passed. Let's get it to the President for his signature, and let's truly begin to deal with this epidemic. It's at crisis levels. It's urgent. It can't wait. So that we, all of us, can begin to make a real difference for those who we represent. Thank you, Mr. President. I yield back my time.